I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and, you know, he'd say, "Daddy's sick," and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.